There are times when a person dealing with a substance abuse or mental health issue can't travel to get the help they need, and that's when a mobile response team from the Council on Alcoholism and Drug Abuse of Northwest Louisiana can step in to help. So joining us today, we have CADA's Executive Director, Janet Miller, and the Crisis Mobile Response Team Coordinator, Tanisha Lassane. So thank you, ladies, for being here.
Absolutely. Thank you for having us.
We're excited to talk a little bit about the resources going into our community. So Tanisha, tell me a little bit about the mobile response team and how it works.
Well, we have a group of individuals that go out into the community and respond to those that are having a mental health or substance abuse crisis.
So how do you identify somebody who may need your assistance? Do they reach out to you first, or can a family member refer you?
Yes, a family member can refer, or they can reach out to us as an individual themselves.
Okay, so there are different ways to make that connection. Janet, let's talk a little bit about how the mobile response team got started.
Well, it got started when 988 Lifeline came into the area and into existence for the nation to help people with suicide or crisis calls. And then the offshoot of that was to be the mobile crisis teams to help people in real time in their communities, the environments that they're in, helping first responders not have to deal with things that are crisis or substance use issues, that our trained staff will do that in place of them.
So you guys are really stepping in to fill that need for somebody. You mentioned suicide, that is one area that you guys address, but what are some of the other needs that the mobile crisis unit can help with?
Those that are having substance abuse issues and sometimes homelessness, just anybody that's in a crisis.
So anybody who may need a little extra help or a little guidance or attention, because sometimes, especially when you're going through such a hard time, you may not realize what resources are available to you.
Correct, and that's what our team do. They'll go out and connect the person with the correct, right resources and try to keep them in the community instead of maybe taking them to jail or taking them to the emergency room.
So making sure that you guys are kind of the hub and say, look, there's somebody here who can help you with whatever your need is.
Yes.
So which areas are you guys covering with the mobile crisis?
We actually cover the 9 parishes, so we are hitting rural areas, Shreveport-Bossier, Sabine, DeSoto, all the different areas. They can contact CADA directly. They can call 318-222-8511 and then press 1 for the mobile crisis. They'll go directly into our phones and someone will answer it and help them. You can also call 911 and ask for them to transfer, divert the call to them or give them information. But 988 is really in collaboration and partnership with us to provide that service on the phone or texting or chatting for someone until we can get there.
And that was one thing that I was going to ask. You know, a lot of people may be thinking, well, this is a 9 to 5 kind of setup. You know, what if I have a situation on the weekend or in the early hours of the morning? Because oftentimes that's when people are feeling at their lowest.
Right, and so we're 24/7, 365. So we have a team always ready to deploy and meet them where they're at and wherever it is. And again, if it's a rural area, we'll get them there. We obviously take a little time to get there, but we have resources for that to help them on the way with phone calls and different things that we can do. And we really want to help people where they're at and not have the police have to get involved or EMS or fire department, any of the first responders that really need to be doing other activities and things that they're trained to do. We should be trained, and we are, with our staff on the ongoing trainings that we do for suicide, crisis intervention, substance use, mental health, co-occurring disorders, that they can meet those needs quicker. And so someone can call us or someone can refer someone to call us directly.
That's wonderful. And Tanisha, you mentioned that you've got a great team of folks that you're working with, right?
Yes, we do. We have a great team that's really passionate about what they do and committed to helping those in the community.
Well, ladies, let's remind everyone how they can reach out if they need assistance.
Sure. If they would call CADA at 318-222-8511.
All right. Well, ladies, thank you so much for being here, and thank you for sharing all of the great work that you're doing in our community, and our community is better for it.
Thank you for letting people know.
Thank you.